Welcome to my world. This is another day, another time. We have started another journey in trying to impart knowledge. Knowledge is power, health is wealth. We need to have more of this knowledge on the matters that concerns our health. Today's topic, I shall be talking about Thyroid Function Test Knowledge. Let us acquire knowledge in the area of thyroid. What do we mean by thyroid? Thyroid is that gland. It's a gland. It's more of an organ, but because it's small, it's a gland that secretes hormone and is located around the thorax, on top of the thorax region. And you have a situation that is so common when you want to talk about thyroid is the goiter, that is the swelling around the neck. It was so common those days when foods were not fortified with iodine. Lack of iodine really brings about these goiters many years ago, but the food we eat these days are fortified with iodine. And the situation is not as common as it was before. That thanks to knowledge that was acquired along the line that has now made clearer the problem associated with what really caused goiter. Yeah, the basis of thyroid function test is to really examine for those things that the thyroid gland really produce. The three main things it produces are the T4, T3, and calcitonin. T4 is thyroxine. T3 is triiodothyronine. But these two, especially the first two, the thyroxine and triiodothyronine, would not be produced if there is no iodine. Iodine is so essential because the body itself cannot produce it. It has to come from outside. And when it is taken in, it has to enter the blood and the thyroid gland will trap it. It is this thyroxine, the T4 and the T3 that are produced that aids metabolism. It speeds up metabolism of all the cells. So you find a situation where the pituitary gland, there is a pituitary gland, producing thyroid stimulating hormone that controls the level of production. But when there is a problem of very little presence of iodine in the blood, the gland will now have to enlarge, and that is where you start having problem of either hypothyroidism or hyperthyroidism. That is when hormones are produced in excess and they are now doing more work, because when you are talking of metabolism, you are talking of breaking down and building up of substances, things the body needs, and you need energy to perform all these processes. So it makes it possible with that process possible by controlling metabolism. So how do the people appear if you don't have this iodine? You now come out of the person appear with goiter around the location of where the thyroid gland is the swelling. Sometimes it produces nodules, sometimes it's diffuse, and that is what is called the goiter. But goiter has been taken care of in so many countries where the surrounding there is no iodine. But what is now done is to fortify food that we eat, even the water we drink with iodine. The most serious problem is that Graves' disease, and it's very symptomatic because the eye will bulge out, and that's what I use as the catch with my troop name display, so that when you see these kind of things, you want to believe that is this person afraid? Even some will think the person is a witch, or know to them that he has a disorder that concerns the hormone produced by the thyroid gland. My concern is to talk about thyroid function test, which we can only know by the substance, the hormone that is producing, the function it is doing. It is that hormone that, like I said, is metabolism. So the hormones are what we now check for to know whether it is produced at a normal level or it is at a higher level than normal or lower level than normal. Once it's normal, there is no disturbance. But when it is higher, that is when you start seeing different symptoms. And when it's lower, symptoms. But generally, problem of iodine shows clearly as goiter. And the Graves' disease itself, hyperthyroidism, is like what is confusing, because you may not really be able to pinpoint what causes. In the beginning, the Graves' disease was so difficult to explain because the cause, even after removal of some part of the thyroid glands, the thing was still happening, and they now sense that there is this substance that must be in the system called LATS, long-acting thyroid stimulator, that continues to stimulate the thyroid, so it continues to perform highly even without regulation from the thyroid stimulating hormone. But as knowledge continues to expand, the LATS has now been confirmed to be antibody stimulation. That is, that substance is an antibody that is it's like an immune system problem. When you now talk of one's own immune causing such a problem, and that understanding has brought about the correct treatment for such for Graves' disease that is not common. Once it's seen and you go to the appropriate hospital and meet the appropriate doctor, that symptom is known and the right test done, and that takes care of that. There is also thyroiditis, that is inflammation. It's more of an infection. The commonest infection is Staphylococcus aureus, Streptococcus pneumonia, because these are resident organisms around that area and they could cause a problem. The explanation will be exposed more when I start going into the slide to really present the aspect of the laboratory performing the diagnosis, and also the treatments and prevention, what and what that we might need to. Like I've always said, if you like what you listen to, press the subscribe button. If you like the more presentation, press the like button. And that's thyroid function test. The definition of thyroid function test, we have the goiter. Goiter is the enlargement of the thyroid gland. There are basically three main types of goiter, namely the diffuse goiter, which is identified microscopically, exothermic goiter, which is the bulging eye, and the nodular goiter. Goiter generally is more common in women than men in the ratio of 5:1, and it could also be classified as simple goiter, endemic goiter, adolescent goiter in terms of its appearance, the consequence of insufficient iodine in a settlement, and the period in life when the hormonal activity experience is high. You can think of the puberty period. The goiter will come around age 15 to 25. It will come, and the demand for metabolism is high. So there is that chances of goiter. Goiter are also harmless and may go away in a short time without treatment. Hyperthyroidism, this is a disorder that causes high production of thyroid hormones and could predispose to grave disease or simpler goiter only. The grave disease is the bulging eye. Hypothyroidism is also a disorder of low production of thyroid hormone and could give rise to cretinism congenital. When we talk of cretinism, they were talking of dwarf people. Those with bow legs, they are dwarf short. It is a problem of the thyroid gland that is not well formed in the womb. So it's a problem that is permanent, cannot be corrected like the other types of problem or symptoms you see. And then myxedema is acquired. It happens around after 40 years of age. It could be autoimmune. I mean, when you talk of autoimmunity. And thyroiditis is the inflammation of the thyroid gland as a result of bacterial infection that you can suspect Staph aureus and strep pneumo or even strep pyogenes. Lab diagnosis, that is where it concerns more the confirmation of hyperthyroidism or hypothyroidism, and it's based in the hormonal lab. The normal values you get is 5.0 to 11 microgram per deciliter for thyroxine, and anything lower than that, than 5, is regarded as hypothyroidism, while anything above 11 is regarded as hyperthyroidism. The free level 2 are also measured along, and you can also use it to classify. The T3 triiodothyronine, you find the normal value at 100 to 200 nanogram per deciliter, but anything lower than 100 is hypothyroidism, while anything above 200 is regarded as hyper. These are the free T3, that's the level of measurement. Thyroid antibody test helps identify different types of autoimmune thyroid condition, which were earlier called long-acting thyroid stimulator, which I mentioned earlier. You can even get it from the TSI, thyroid stimulating immunoglobulin, and you have thyroid blocking immunoglobulin. The Thyroglobulin test for diagnosing thyroiditis is also useful in the lab, and ESR is very, very useful because the high level of for the electrolyte sedimentation rate, you will know it's infection. And like I mentioned, you can suspect Staphylococcus, strep, and any other organisms around that area. Imaging tests, also called thyroid scan, you can scan to look at the size. That is also very useful, but it's not as definitive as blood tests. There is also the physical examination where you feel the palpitation, the swellings. Prevention. According to a report published in Journal of Clinical and Diagnostic Research in January 2016, Iatrogenic food are certain types of food that can reduce the absorption of the T4 thyroid hormone and negatively interfere with the way the thyroid hormone works. That may be useful in situation of hyperthyroidism when you have high level of it. The examples of glycotrogenic food is mentioned there. Also, you can do prevention by avoiding high iodine food, especially if the person has goiter. The current recommendation for iodine is 150 microgram per day for all adults. If you are pregnant or breastfeeding, that's when there is a high requirement. Like I said, it could even present with goiter. When there is a low level of iodine, the thyroid gland will have to multiply itself and create that goiter, which will go after a while, just to make sure that it meets the requirements of the hormone needed for metabolism at that period. So, if you are pregnant or breastfeeding, your needs go up to 220 and 290 micrograms respectively. Iodized salt is also a major source of iodine. 1/4 teaspoon contains about 71 micrograms. The treatment is for hyperthyroidism. Options could include anti-thyroid drugs, radioactive iodine, and beta blocker. Surgery can also be done when the goiter refuses to go for a long while, and if there is a hypothyroidism, thyroid replacement medication